So, your employer has decided to implement an open access health plan. But what is an open access health plan? An open access plan does not restrict you to only seeing in-network providers. What does open access mean for you? The purpose of using an open access plan is to increase access to all medical providers and to address runaway healthcare costs by paying providers based on fair and objective benchmarks. Why is my employer implementing an open access plan as part of our health insurance plan? The cost of U.S. healthcare has skyrocketed and is the highest in the world. Why? Because hospitals are allowed to set their own prices without effective regulation from the free market. Would you pay over $200 for a Tylenol that you can get at your local grocery store for less than $1? No. But traditional networks often agree to pay these absurd prices. Why? Because it's not the network's money. The network is spending your employer's money, which ends up impacting you. Your employer is saying no to a broken and out-of-control healthcare system. Who manages my health insurance plan? Your employer has partnered with a third-party administrator known as a TPA. Your employer is busy doing what your employer does, so your TPA is here to run the health plan, like keeping track of your benefits and paying medical claims. So, who is 6 Degrees Health and how are they involved in my health insurance plan? It is important to understand that 6 Degrees Health is not your insurance provider. 6 Degrees helps your TPA review medical claims and resolve any issues that may arise with a hospital or physician. For example, 6 Degrees works with providers to help answer their questions about how they will get paid or working with a provider to resolve a disputed balance on a health claim. What if the medical provider does not recognize my health insurance plan? Inform your medical provider that your health insurance plan does not require that they participate in a network to provide care for you and get paid. Your medical provider should collect any applicable copay and submit a claim through your TPA using the information listed on your member ID card, just like they would for a traditional network plan. What if my medical provider still has questions? Have them call the TPA directly for assistance. The number for your TPA is listed on your member ID card. How will I know what my health insurance has paid? After any medical service, you will receive an explanation of benefits, or EOB, in the mail from your TPA. It will include a breakdown of what medical services were provided and what benefits were paid. It will also show what amount is your responsibility according to the plan terms. What issues can occur with an open access health plan? Some members experience what is called an access issue, which is when a provider won't provide care for an elective visit. Note that federal law protects all patients from being denied emergency room care, regardless of insurance or ability to pay. Also, some members may receive a bill from the provider in excess of the member's copay or deductible after the insurance has paid the claim. We refer to this as a balance bill. If you have an access issue or receive a balance bill, report them to your TPA as soon as possible. Please refer to our access issue or balance bill videos for more details. It is important to remember your health insurance is an open access health plan, meaning you are not restricted to only seeing network providers. Your health plan is managed by a third-party administrator, partnered with 6 Degrees Health to review claims from your medical providers. The medical provider should only collect copay amounts and bill the remainder of the balance to the TPA. Contact your TPA directly with any questions or issues.